So, hi everyone. Thanks for joining in. I've been away on maternity leave and I'm happy to be back, feeling strong and feeling alive. And I'm very grateful to not only eating healthy and being able to sleep and drinking clean water, but to all the herbs that I've been taking. I mean, plant medicine really is something that I not only preach about to my patients, but I live by it. And it's changed my life for the better. And each plant that I learn about over the years and I incorporate into my life really brings a new light and a new colors to the frequencies that I see and feel. And it really changed my life. So I'm happy to talk today about three main herbs or plants that I've studied over the years that can help to strengthen bone and also soft tissue, including tendons, ligaments, and cartilage within joints. It's important to have this conversation today because I think that bone mass is necessary, right? As we get older, our hormones change, our amount of physical activity and nutrition, particularly calcium and vitamin D, play a role in maintaining the strength of our bones. And if we don't maintain the strength of it, what happens is they become weak and can cause pain and even deformity. Osteoporosis can lead to bone fractures in women and men over the age of 60. But also, if we've had injuries, if we've broken a bone from playing sports or had a bad fall, unfortunately, we have to think of these things, right? Also, injuries, which happen to everybody, right? Most people get injured, right? Can cause weakness in soft tissue and which surround the bone. So that is the tendon, which joins muscle to bone, ligament, right, which join bone to bone, and also the cartilage, which is the cushion or the pillow between bones, like the meniscus of your knee or the labrum of your shoulder or hip. Some conditions of hyperelasticity, such as Ehlers-Danlos syndrome, cause patients who have that condition to be more flexible. So there's a lot of people that are very flexible, meaning that their joints bend extra, like their forearm would bend more than just a straight line, or their knees can bend backwards. And there's a lot of patients like that, and they tend to get injured, have sprains, have strains, even dislocations their entire lives, and are worsened. These injuries can become worsened with periods of inactivity where the muscles get weak over time, or even pregnancy. I mean, I've experienced that because you release a hormone called relaxin, which can cause all of your joints to become loose and you can easily have injuries. For others that just don't have this hyperelasticity and just exercise a lot or do sports or run, etc., and are prone to injuries in general, there's a lot of reasons for that, right? Some people are prone to spraining their ankles. Some people have had one injury of their knee and subsequently continue to injure their knee over the years. Over time, each time you have an injury, the body heals itself by producing more keratin, which hardens the cartilage, and fibroblasts also, which bring the cartilage back together, but it doesn't go back to the way it used to be. It loses elasticity. So what happens is now you have a joint that may be healed, but it's stiffer, right? And that stiffness is something that we all complain of as we age, and it interferes with our ability to stretch and move, dance, run the way we used to. So an analogy is like stretched leather. The more you stretch leather, it becomes dry and damaged with use. And it doesn't just go back to its original shape, it gets stretched out and dry. The only way that you can maintain leather's flexibility, like skin and like cartilage, is if you massage it and you oil it, and the oil being the analogy to the right herbs and right? Which I'm going to talk about today to help maintain that elasticity. So overall, what we want to do is keep our bones strong, keep our soft tissue strong, right? All the cartilage that surrounds our joints that can increase moisture and flexibility in our muscles in general, and can help also repair from injuries so that we can have a happy life, which includes moving around and doing things and having fun and not feeling stiff and old. And there's this idea of vitality that in the Tao, how they say is as you become old, you get stiff, as I mentioned. And what you want to do, like a tree, is have strong roots in the ground, also meaning referring to your bones, have strong bones, be strong enough so that you're able to move with the wind and sway, right? So you can also be flexible when life moves you one way or the other. Otherwise, when a storm comes, your branches will snap and you'll fall over. So that's why this is important today. And I like that analogy because it's a good visual to have. We want to be strong, we want to be rooted, but we also want to be able to move with life stressors. Life throws things at us and we want to be able to dance with it, right? So what I wanted to start with today is a really incredible herb called Solomon seal. Solomon seal are the herbs, genus and species name is Polygonum sibiricum. The nickname is the musculoskeletal healing wizard. And that's a really cool name. When we look at plants, it's really interesting because the way a plant looks can sometimes, or a lot of the times, tell us how it's going to act on the body, and the way that it has its leaves and its stem actually look like it could be stacked vertebrae of the spine. And that's how they use that analogy, how it works on bones and can heal soft tissue. So the idea of Solomon seal is that it's a beneficial demulcent, or it brings fluid and soothes the irritation of mucosa and lubricates bones and joints. That's really important, especially, I know these are all lots of words I'm throwing out there, but for example, if you are prone to, in Ayurvedic terms, being more vata or air prone, where you have dry and achy joints, dry skin, you lose the lubrication in not just your joints, but in your body in general, if you're more air prone. And something like Solomon seal could be great as a nourishing tonic, or to strengthen the yin, as they would say in Chinese medicine. It not only lubricates joints, but it helps with the heart and lungs. It builds your bone marrow and even increases semen. So you're the essence of men. One thing I want to point out is when we study medications usually have one usage to work on one specific pathway, and that's it. And they usually have immediate effects. As opposed to herbs may be studied for one specific thing that you may know of, but can be used for so many different parts of the body, and even more than we know. So when you take an herb, your whole body goes through a transformation in ways that you don't even can really even put into words, because it works on so many parts of your body. So for example, Solomon seal has been used a lot and is excellent for sports injuries, pulled muscles. It ensures that there's fluid balance and nutrients are going into the muscle, into fascia, and into that web of connective tissues that holds your muscles together and in place. There's actually been a study on Solomon seal that shows it has protective properties against knee arthritis, and has been shown to inhibit certain inflammatory responses from the interleukin 1B and nuclear factor kappa B signaling pathway on chondrocytes, or in simple terms, the inflammatory responses on the cells that create cartilage. Therefore, it promotes the matrix strengthening parts of bones as well as cartilage. And one study on mice showed that it alleviated the development of knee arthritis on medial meniscus induced arthritis in mouse knee joints and reduced inflammatory cytokines that can destroy the knee joint. So that's really cool. In essence, Solomon seal brings water to the joints. It strengthens bones. It stops inflammatory pathways that can break down the joint and cartilage, causing arthritis. So it could be used to treat an injury, also to prevent arthritis in the future. Just as an overall, there's no negative side effects, but the only thing that's been shown is that if you take a high dose, it can cause some GI discomfort like nausea and vomiting. Dosage may vary. So that's Solomon seal for you, the musculoskeletal healing wizard. Now, the second herb that I want to talk about is horsetail. Horsetail, or the other name for it is the Equisetum hyemale. Horsetail is really cool. I mean, you can imagine why it's called horsetail, because a horse's tail horses have beautiful hair, long flowing hair that is strong, and everybody wants horsehair, right? So that's actually why it's called that, because it has not only been used for joints, but it's been used for hair and nails, and also for healing the gut. You know, a lot of my patients know about the animal form of strengthening their joints, like collagen protein. Everybody uses collagen protein, drinks bone broth. But then I have patients that say, well, what if I'm a vegan? What if I don't want, right, Anna? Right? What if we don't want to have animal products? Well, that's when we use plants. That is the essence of having a plant-based diet and plant-based medicine cabinet. There are so many plants that can be used. Horsetail is one of those vegan alternatives to collagen protein, that I think is good for everybody to know. And the plant is a fern that has been around for like thousands of years, from the dinosaur times. It's a very old plant. And I think that we can trust in plants and organisms that have been around for thousands of years, because there's a reason why they haven't been killed off. There's something about them that has been keeping them alive and strong. And this plant grows in water and has a long stem, and it kind of sways in the wind, and it has a little like brown thing on the top. And I think everybody's kind of seen them around. And it contains a antioxidant silica, which strengthens the skin, nails, hair, and bones. So silica is a mineral from the earth that I like to prescribe for, my patients with osteoporosis. And because it makes the constituents of your bone stronger, especially with, vitamin D and calcium. There's been studies that show that horsetail may inhibit osteoclasts, which are the cells that break down bone, like in osteoporosis, and stimulate osteoblasts, which build bone. And silica can improve the formation, density, and consistency of bone by enhancing calcium absorption. So a study on rats was shown to rats who received horsetail showed increased bone mineral density only after 30 days within their mandible. So that's their bottom jaw, even more than the group that received just calcium and vitamin D. So I think that says a lot. There are other things that we can do besides just vitamin D and calcium to strengthen our bones, especially if we know that we're prone to injuries, have had fractured bones, or we have osteoporosis in our genetic line, right? Once on something other that horsetail can do, it also has been shown to increase the healing of wounds. So one study showed that horsetail used in rats can accelerate wound healing by increasing fibroblast collagen synthesis and inhibiting the cytokine pathway that can destroy collagen formation. It has also been shown to be antimicrobial by inhibiting the growth of Staph aureus and Candida albicans. So, for example, for diabetic patients that are prone to wounds and injuries, it can help in so many ways by not only speeding up recovery with an injury to broken skin, but to broken tendons, soft tissue, and bones altogether, and also reducing the amount of bacteria in the area healing, which is huge for even like post-surgical patients, right? That want to be able to heal faster and become stronger and not have to worry about bacterial growth. Other things, like I said, it's also been used in hair growth. I mean, it can be taken orally or used topically for hair strengthening, anything that involves the collagen, it's been used for. Other things that it can do, it's been used as a lung tonic and even been used as a diuretic, which I just learned about, to help break up kidney stones. Very cool. So it clears the bladder and it tonifies the bladder as well. So the same way that it strengthens the collagen of your hair, your nails, your bones, it also strengthens the urinary bladder muscles. So it can help with urinary incontinence, urethritis, prostatitis. One study even showed that it was used topically on post-episiotomy women that have had after labor and had increased the healing of the episiotomy significantly. So it's pretty cool. Horsetail is pretty awesome. The only side effects that I have seen is that it may cause liver injury, especially if you're prone, or if you have kidney disease, it may increase potassium levels. So just be careful if you have kidney disease as well. So very cool so far. We've got Solomon Sail. We went over horsetail. And now my other favorite, which I want to talk about because I have personal use and a personal story to it, is Chuchuhuasi. I'm sure nobody's heard of this before, and that's why I love having these conversations, because I love digging into hidden plants of the earth that people don't know about. So what on earth is Chuchuhuasi, right? I'm Peruvian, or at least I have Peruvian roots. And Chuchuhuasi is a tree, the Maitenus laevis tree from the Amazon jungle. It's been nicknamed as the Brazilian ginseng. When I went to Peru a few years back, and I went to study plant medicine with an herbalist in Chazuta, Peru, which is the jungle, pretty much nowhere in the middle of the jungle, by this beautiful man, Javier Ohanama, and his family. I stayed there for a month, and I was taking Chuchuhuasi 3 times a day, which he was serving to me, because that's why I do sports medicine. I had a lot of injuries, my knee, my back, my neck, and I was looking for something to help strengthen not only my body, but my spirit. As so Javier, the herbalist, had told me. And that's why I was taking this Chuchuhuasi, and I felt my body become stronger in such a way that it's really hard to even put into words, really, but my pain had diminished. I was not spraining my ankles as much. I felt more stability in my knee, and I had continued to take that over 6 months. In fact, I started taking it again postpartum, because it's actually been used and studied to promote the regularity of menstrual flow and bleeding, and to help tonify the uterus. So what I want to say about Chuchuhuasi, it's commonly used to treat osteoarthritis and rheumatoid arthritis, because it has the ability to inhibit protein kinase in inflammatory and degenerative joint diseases such as rheumatoid arthritis. And it's really called an adaptogen because it helps to not only stop inflammation, but to restore balance to your joints and your body as a whole. They say it protects you from external stressors and helps to also strengthen your adrenal glands. So if you're prone to stress, it can help you react to stress better and also help you sleep better. And that's what an adaptogen is. If you're familiar, like to ashwagandha and ginseng, rhodiola, those are other adaptogens from this country. Also, it has been used for, as I mentioned, to strengthen joints, been studied extensively in fibromyalgia, rheumatoid arthritis, and even on fatigue, patients with Parkinsonism and prone to strokes and hemorrhages, as it helps to calm the nervous system and repair damage to the nerves, to the muscles, soft tissue, and bones in general. Chuchuhuasi is a really beautiful tree that I've had personal experience with, and I think that it should, be used around the world, especially here, as it's a beautiful tree from the rainforest. And also, there's no known side effects to taking a lot of Chuchuhuasi. It's relatively safe. And that's what I wanted to say about Chuchuhuasi. So those are the three top herbs. Of course, I have others, so my mind just goes flying in all directions, but I'm going to stick to those three today. I also wanted to mention that one of the things we've been using recently in the clinic is peptide BPC 157. So peptide BPC 157 is the new talk of the town, and it does everything, or it's supposed to, right, that these herbs do. It's an injectable peptide that you can take once a week or eventually every day to help strengthen the formation of collagen. And collagen is everywhere. It's in the gut, which is, I think, less studied on these plants. So as I mentioned, that these plants help tonify the bones and soft tissue, which is everywhere, the cartilage, hair, nails, it's also in the gut, which is what we talk about a lot in Akasha, right? Leaky gut syndrome. So BPC 157 can help tremendously with patients that have had injuries, ankle sprains, knee injuries, hip and back arthritis, and even help with leaky gut. So I just wanted to put that out there, that, we can go in any direction we want. When we want to heal, we can use peptides, we can use medications, and then we can also dip into herbs and vitamins for a more holistic treatment for what we're trying to accomplish. And when it comes to herbs, they can be used safely, trustingly, with a love for Mother Earth and knowing that the earth has your back and is here to support you in many ways without all the bad side effects. And I just wanted to say, in conclusion to what I wanted to present here today, is that I'm Gina Galvez. I'm an integrative physician assistant here at the Akasha Center, and my specialties are in sports medicine and regenerative medicine, meaning regenerating new collagen, bone, as I work with PRP, your body's own magic. Our golden serum is in our platelets to regenerate collagen and bone when it's reinjected into our bones, our joints, and also in our skin and our hair. So, and I also help people with gut disorders, and I'm an IV vitamin specialist and also a Reiki master. So I'm so happy to be presenting these awesome herbs to you today, and look forward to hearing from you if you want a consultation to talk more about how they can help you. So thank you.
Can I ask a question, Gina?
Yeah, thank you,
You
Anna.
did mention that we can do the peptides one time per week or every day if we like, right?
Mhm.
In regards to these wonderful herbs that you mentioned, specifically the horsetail, but all the other ones as well, how often would a patient need to have these herbs in their life? Would it be like every day? Would it be once a week? Or how are these prescribed to patients?
It depends on what you're trying to treat. if you have significant hair loss, for example, or you just had an injury that you're trying to heal from, you'd want to use it more often than not. If you want significant effects, you'd want to use the herb 2 or 3 times a day, where you'd see faster results maybe in 2 or 3 weeks. But if you used it once a day, you might start to see results in 2 months. And that's a great question, because the another difference between medication and herbs is that medication you take once and you usually feel the impact on your body immediately, like within hours. And then it has a lot of side effects. So the faster something induces an effect on your body, it usually comes with side effects. Herbs are cumulative. So the more you take an herb, it accumulates in your body and works more. So the way herbs work, and the best way to get the faster results, is to take a little bit every 2 hours, 3 hours, even if you want to get more results. If you take it one time, you probably won't have any results, because they work with your body to help slowly and kindly work with your body to produce these results.
Gina, what if you want to use them in a preventive way? Since you said that as we get older, you get stiff and you don't want to wait for an injury to happen. So maybe you can use these herbs in, in your daily life, or how would you use them to prevent or?
For sure. I think that's, a great question, right? So like if you're not prone to injuries at all and you're like, let me strengthen my hair, right? Let me strengthen my skin. You can take them every day if you want to, or if you want, take them a couple of times a week if you'd like, orally. Something like horsetail, you can buy an oil serum. Sometimes they're even mixed with biotin and keratin and things like that, and apply it to the scalp and massage into the scalp, massage it onto your nail beds to strengthen your nails, for example. Also something like Solomon seal, or right, can be used if you're prone to injuries. Let's say, you dance or you do a lot of yoga and you've injured yourself a lot. You can take Solomon seal every day or twice a day to help tonify your joints and strengthen them while still maintaining flexibility. In fact, I've been taking Solomon seal now for 6 months and I do feel stronger.
Thank you. Yeah, that's good.
And herbs can come in so many different forms too, not just an oil or a pill, but it can come in a tea form. So there's some teas that you can drink every day, something that's less medicine-like, something that you can enjoy, right? And even some tinctures, some patients shy away from because it's usually mixed with alcohol, but there are tinctures that are mixed with glycerin, which is it's vegetable source where it doesn't have any alcohol, that you can take herbs in liquid form.
Thank you.
Yeah, sure. For example, when I talked about horsetail, a patient that has kidney disease or liver injury should be cautious of using them. Yeah, I mean, these herbs are pretty safe. They're great and, have their own energy to be experienced.
So with all of these herbs, you did mention strong roots in the very beginning. These are all herbs that are able to build strong roots for the body, correct?
Yeah.
Help the body build strong roots. Okay.
Yeah, that's why, from a more spiritual sense, Chuchuhuasi can not only build strong muscle and bones, but it can strengthen your self-esteem, build your confidence. So it strengthens you from the inside out in all ways, as my herbero from Peru put it. It will make you strong.
And where is the best source of purchasing these types of herbs?
That's a good question. It's always good to buy these herbs from reputable sources and herbalists.
Mm-hmm.
Good connections, of course, so you can always ask me.
Okay, perfect.
It's, anything buying on the internet can be tricky. So I say buy it from a reputable source or any supplement brand that has been well studied. Yeah, any other questions for me?
Which one is better for people that have any problems on the joint and have pain constantly, like chronic pain, and not like an injury that happened from sports or something like this?
I think from what I've studied is that the Solomon seal and Chuchuhuasi has been not only shown to strengthen your joints, but to reduce inflammation, reduce pain caused by the inflammatory cytokines that produce this inflammation.
And also works for people that have arthritis and that kind of condition.
Yes, exactly. All of these can be used for patients with arthritis that are prone to injuries that have or broken bones. Yep, any of these.
So Gina, I know that you are really into herbs and all of this. But I know that there's some other types of therapies that we could do, right? What about PRP therapy? Does that
Yeah,
also help with injuries for the joints and the
for sure.
muscles?
All of the
You
things
could
that
use
I'm
them.
mentioning can be used in conjunction.
Mm-hmm.
And I like to use a beautiful combination of taking the holistic approach to healing injuries, right? So when we're healing an injury, I want to make sure that we're looking at the body as a whole. So seeing if there's any hormonal imbalance, such as thyroid conditions, which can increase pain in the body. We want to make sure that vitamin D levels are up, and calcium. Low vitamin D can lead to joint pain, muscle pain, and aches that can be repaired. And also, in terms of healing the body, we can take something orally every day, like Solomon seal, Horsetail Chuchuhuasi, vitamins that can help strengthen the bone, strengthen the soft tissue on a daily basis. But sometimes we need something stronger. And that's where I've been doing this for years, and using your own platelets or PRP to be re-injected into injured soft tissue, into sprains, into the rotator cuff, into the meniscus or the labrum of the hip, for example. All of these things can be used to help heal on a faster level. When PRP is injected into soft tissue, it also has direct anti-inflammatory effects in the long term. So it also inside the joint reduces inflammation, reduces these cytokines from building up, and has regenerative growth factors that are released from the platelets that help grow new cartilage, help grow new osteoblasts, which create bone, and also help grow skin and hair. And it's, of course, directed into the injury, which can help to speed up healing much faster. Sometimes we go around the block doing lots of different things, and when those things don't work right away, that's when doing a PRP injection can help. And then we also have the acoustic wave therapy. Let's say you're afraid of needles and you want to try something that has great results directly on an injury. The acoustic wave therapy has been shown to have high voltage ultrasound directly into the injured area, which can break up those fibroblasts that make a ligament or tendon really stiff and hard, and can increase blood flow to that area without having to have a needle injected. But it can also be used in conjunction. So what I like to do is put patients on a protocol where they're doing, acoustic wave therapy with vitamins, with herbs, and then balancing the hormones and reducing stress in the body. And then when that happens over a little bit of time, then I prepare them for PRP treatment so that we can really heal things on a deeper level and change out those old, hard chondrocytes that are hardened like that old leather and make them nice and elasticy again so that, you can have your life back and get back to sports and do what you like to do. Just depends. Herbs I wouldn't worry about, but some supplements or medications I would.
And at what point would you like to introduce IV therapies for patients when they are dealing with injuries?
Yeah, so IVs are great, right? Why are IVs so great? Because, when we take something by mouth, it has to go through the stomach and then be filtered by the liver, and then we only get 10 to 20% of whatever we take orally. And then for patients that have leaky gut, I mean, everybody's got leaky gut. You don't even know what you're really getting after you're taking something orally, and it takes a long time to get a response. When you take something that goes directly into your vein, you can have immediate results, like vitamin C has been shown to increase the healing of skin and any injuries of the body, including cartilage and bone. So, doing high dose vitamin C, for example, is super important. We have vitamin D injections. If you have low vitamin D, which I see all the time, and which is why you need to get vitamins from a reputable source. Like we have a great vitamin D at Akasha with vitamin K. If you're not taking vitamin D from a good source, some patients are like, I've been taking this vitamin D for 2 years, and then their vitamin D is really low. It's like under 30. And then they're like, how is that possible? I take it every day for 2 years. Well, you don't really know what you're buying. The FDA does not regulate supplements. So you never know what you're even taking. You could just be throwing your money away if you don't buy vitamins from a reputable source. And then if your vitamin D is under 30, for example, you're going to be tired. You probably have bone and muscle pain, and not just in one area, but lots of different areas. So we want to get that vitamin D up even, before we're looking at anything else to help minimize your pain and strengthen your bones. And that's where a vitamin D injection can help to speed that up for you, so you're not taking something by mouth for months and months and still feeling pain. These are all really good questions, because all these things I like to do in a beautiful harmony together with my patients and really heal on a holistic level, where it's not just about injecting PRP, right? It's about looking at the body as a whole symphony and making sure all of the plates are spinning beautifully in harmony. Our vitamin levels are up, our hormones are regulated, we're digesting our food, we're eating mindfully, we wake up and we say our gratitude, we go on walks, and we're, thinking about how to build our body, optimize our vitality in a positive way. And that's the mindset as we attain our health goals.
One last question. What is the latest technology in injury treatment, and how can they make a difference in recovery time?
I think PRP, using platelets, our body's own stem cells, is certainly the latest technology being used. There's other things that are being implemented with PRP, like stem cells, A2M, things that can strengthen them, all things that are up in the coming process at the Akasha Center, of course, beside surgeries. So those things are great to be used in combination, although it's good to compile all the latest data and see what studies show and show their benefits before jumping into something new. So that's what we like to do here at the Akasha Center. That's what I'm doing, is to make sure that there's adequate research into new technologies before using them so that I could fully trust in them. And that's one place that I like to lean again on herbs, because some things are made really well in a laboratory, and other things Mother Earth has made absolutely perfectly for us, and they're safe and you can really trust in plants.
Well, I want to thank Gina for taking her time out. I
Thank
thought this
you.
was beautiful. I loved the fact of these beautiful supplements or herbs that she's provided to us. And if anybody has any other additional questions, we could always reach out to you, Gina. And
Great.
thank you again for your time. Hopefully we could reach out to you soon.
Yeah, once again, I offer 10-minute educational consults for any patients interested, if they have injuries, if they have arthritis, if they're looking to heal a certain injury like shoulder, knee, right? For example, neck pain. I'm more than happy to offer a 10-minute consult to just see where you're at and see how I can help you.
Thank you very, very much, Gina. And thank you everybody for
Anna.
joining.
Thanks, team.
Bye.
Bye. May the force be with you.
Bye, Gina.